Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that dial. This is one of the most important programs or shows that I do each year for 21 years, but I think this is one of the most important things. October, the month of October, is breast cancer.
Awareness Month.
Right. So, breast cancer month. So, in other words, to get checked out. We're going to talk about preventions. We're going to talk about treatment, and we have one of, I guess, I can say renowned, one of the most renowned doctors in this whole area that has been practicing for over, 28 years or so? And 28 years here in Norristown, Montgomery Hospital. She didn't float around like a butterfly. She was right here, okay? And taking care of the people here in the Norristown area for 28 years. And I was taking care of 37 years with policemen, so we were both had something in common. But Dr. Graeffe, it's a pleasure, it's an honor to have you on this show. And today it's so important. And I think the last show you were on here, you mentioned about in the southeastern part of Pennsylvania, there's a high number of cancer cases for some reason or other, and nobody really knows why. But we should be concerned that we have one of the best cancer treatment centers right here in Montgomery Hospital. Now, doctor, tell me something about yourself.
Yes, my name is Stella Graeffe. I have been at Montgomery Hospital since
look at me,
October.
because that camera's going to be looking at you.
Since October of 1982. In fact, it was the first Monday in October that I came here, just after I finished my residency at Hahnemann University Hospital in Philadelphia. And I've been practicing in radiation oncology at Montgomery for the past 28 years. I'm now in my third department. Every so many years, we get a new department when we get new equipment. And just this past March, we moved into new facilities in McShay Hall.
Okay.
We have a new machine. It's the most fancy and wonderful radiation therapy equipment in the area. It's ovarian equipment. I do. I have a picture of it. Yes. And thanks to the beneficence of the Karabatz Foundation.
Can you get a good shot of that?
Thanks to the beneficence of Nick and Athena Karabatz, Nicholas and Athena Karabatz donated the equipment to Montgomery Hospital so we would have state-of-the-art IMRT equipment in Montgomery Hospital. And we've been there now for over 6 months. It's a wonderful...
What's different about this machine than what treated? Now I'm a survivor, okay? I survived cancer 2 times. I had colon cancer first, and they operated, took it out. And then later, 4 or 5 years later, I got prostate cancer, and you treated me with radiation. And I remember they said there was the newest machines were in Philadelphia, but then you had the
IMRT,
yeah,
yes.
And that focused right into where the cancer was. It didn't damage some of the other ones, right?
That's correct.
Then this machine here is...
This is also IMRT, and what that means is intensity modulated radiation therapy. And with this type of equipment, we're able to concentrate the dose of radiation exactly where we want it, and we're able to spare...
Right there, not damage other cells.
Yes, we're able to spare non-target tissue like the bladder and the rectum. And in addition, with the new equipment, there is what's called onboard imaging, and we're able to do a CAT scan prior to each radiation treatment to ensure that the patient is properly aligned. That way, we can keep the fields of radiation smaller and go to higher doses, and thereby increasing the ability to cure different types of cancer. So the advancement that we have on our current equipment is the onboard imaging. And in addition, we do digital x-rays, so we don't have to use film anymore. We don't have to develop film.
X-rays
it's
too
much
sometimes
faster
can be damaging.
and cheaper, yes.
Right, and
yes.
cheaper.
Yes.
Oh, that's good, especially with the economy the way it is today.
That's correct, right. And not only that.
You always look out for the patients.
And no storage. We don't have to develop the films. We don't need to put them in film jackets. We don't need to put them on shelves. Everything is available at our fingertips on the computers.
You know, families that you've treated, people that you treated, and you get to know the whole family. When somebody has cancer and they stay with them until to the end, and you have such a nice relationship with the people in this community, in the surrounding communities too. So I just want to say you're well-liked and you do a good job. So what they say, do good, forget, do bad, and regret. So you do good.
Well, it's been my pleasure really to work in Norristown over these
Right.
years, and I do enjoy knowing the families and
But they say October is breast cancer month, okay? So we try to do everything. There's walks, there's different things going on. And I think, and Montgomery Hospital, tell me something about this, that we have a walk that helps come up
Yes,
with.
well, every spring we have a fundraiser. It's actually not only a fundraiser, but it's also a community information raiser event. And that is to make people aware of early detection and treatment of cancer and to raise funds for our center. So each spring we have this walk in the park. This year we're going to be having our 6th walk in the park.
Yeah.
It's traditionally the 3rd Saturday in May. This year it will fall on May 21st.
Right.
And it will be at the Norristown Farm Park. And
Yeah,
it's-
right. Well, but they meet at the.
We meet at the high
Norristown
school. Yes,
right
we
there,
start
Whitehall
out at the
Road.
high
Yeah.
school,
We
and
meet
then
there and.
March.
And there's, ShopRite donates a little food along the way, or not food, but water and whatever, you know.
And yes, fruits.
We have a lot
and
of good sponsors, but now, you have another thing going on here. What's this here?
Yes.
Women's Health, now that,
Yes.
and this is free, okay? Don't cost no money,
Yes,
okay? Take
yes.
advantage of it.
And this also is the 3rd Thursday in October. Montgomery Hospital sponsors a women's forum. The women's forum is held at the Plymouth
Community Center.
The Plymouth
yeah.
Community Center on
Jolly
Jolly
Road,
Road.
yeah, right.
And it starts at 5 o'clock in the evening. There are a lot of workshops, there are screening
I saw-
programs.
saw here some
And
of the
there's a lot of
workshops.
patient education, yes. So there will be screenings for blood pressure screening. There will be a program to learn how to do breast self-examination. There will be a pharmacist there, physicians there to ask questions. They'll be talking about behavioral health and mental wellness, blood pressure screenings, blood sugar screenings, education about colon cancer awareness, hearing screenings, and osteoporosis screenings, and many other interesting things. And in addition, there will be workshops on bone health, breast health, cardiovascular disease in women, diabetes education, ovarian and cervical cancer prevention.
All these things free, they're there, the workshops. And
Yes.
you pick one that you're interested in. Not necessarily you, but it might be your cousin, your aunt, your uncle, your mom, your pop, your gumbadi, your gummadi, whatever, whatever. Your little children, you educate, An
Right.
informed nation is a peaceful nation. An informed nation is a healthy nation. So, well, I just threw that in there for,
Yes.
okay.
So this is basically, gearing towards health and wellness for women. It's a lovely event. It's very well attended every year, and people seem to enjoy it a great
Good.
deal. But now we'll talk a little bit about breast cancer, because breast cancer is at the forefront in the month of October. And
October.
in the month of
Wonder
October,
why they picked October.
I don't know.
I'll tell you why. I think because Christopher Columbus discovered America October the 12th, and I think the day's going to come, we're going to find a cure for cancer in October. Maybe it'll be on October the 12th on Columbus Day, who knows?
well, that would be
Discovered-
wonderful.
Wouldn't that be great?
That would be wonderful.
That'd be wonderful. There's a
Yes.
lot of things in October, there's I was married October the 23rd. Frank Rizzo, the mayor, he was born October the 23rd, and so a lot of good things with the breast cancer. We got in fact, right here, this police officer here, Steve Savo from Bridgeport, put 24 years in the police department, and now he came down with a disease they call Lou Gehrig's disease. They're having a fundraiser on the 16th in Bridgeport. And like I say, if you can make some kind of donation, stop in the police station. Like where you pay your tickets, don't pay a ticket, just make a donation. But I thought October is great,
It
And
is.
in fact, my daughter was married on October too. On Columbus Day,
Mm-hmm.
all right? And Governor Thornburg was married on, so October, now we're talking about breast cancer. And that's
Yes.
a pretty good idea. Think maybe we'll find a cure for this? Are they working on that?
They're certainly working on it, and the big thing these days is to look at the genetics of the tumors, and the treatment for breast cancer is becoming more personalized based on the patient's genetic profile. So I'd just like to say a few things about the changes that have occurred between when I first started working here at Montgomery in the
Yeah, when you
early
first started
80s
here,
until now.
What'd you do?
Well, back then, people did not get as many mammograms as they do today. It was just coming into the forefront. And in fact, there was
We're
a,
talking 28 years ago.
we're talking 28 years
Okay.
ago, it was not routine to get mammograms. But starting in the early 80s, that's when there was the big push, when it started to be shown that the mammograms were very successful at detecting breast cancers that were smaller than if you wait to find it by yourself on self-examination. And so back in the early 80s, it was much more common when people came in with larger tumors and positive axillary nodes than today. Today we find much smaller tumors that are much more easily treatable and much more curable. So the reward for doing the breast cancer awareness and having early detection through yearly mammography has resulted in the fact that women no longer need to have mastectomies as much as they did before, and that we have other techniques for treatment which are breast conserving. One method is lumpectomy and radiation to the breast. When I first came to Norristown, there had been one patient in the city treated that way. Now, fully 70% of patients who are diagnosed with breast cancer have breast conserving treatment. So that's been a remarkable change over the last 20, 30 years. Also, another new technique that's been out for the past 6 or 7 years is called mammocyte-guided partial breast irradiation. And because the tumors have gotten so small, it kind of seems like overkill to treat the whole breast.
Oh, okay.
And so for some patients with small tumors, we're able to insert a catheter into the breast and then insert a radioactive source into the center of the cavity, give the treatment twice a day for 5 days, then take out the catheter and the treatments are finished. So we're able to compress all of that breast cancer treatment into just
Different-
1 week
Different
for
types.
people with early breast cancer.
But one of the most important, the early detection.
That would
All
not
right.
be possible without early
All right,
detection.
now we're here in Norristown High School, and it's
Mm-hmm.
a lot of teenage girls, okay? Should they be concerned?
Well, breast cancer occurs more commonly in older people. So
Okay.
the older you get, the more prevalent it is. And it is rare to find breast cancer in women who are below 25. However, there are a few cases reported of women who are under 25. So therefore, it's important for girls to become familiar with what breast cancer is, how to do breast self-examination, and to advocate for themselves. If there's something that doesn't seem right to them in their breast, they definitely should get evaluated. And if
Could
there's
be something else, could be just tumor, not necessarily cancer, right?
many times young girls will have cysts, benign
Cyst,
cysts
okay,
in the
yeah.
breast, or fibroadenomas. That's the most common thing. However, it is possible to get breast cancer, so a girl has to be able to advocate for herself. If something doesn't
Yeah.
seem right, it does need to
We-
get
we-
checked
We don't
out.
want the teenage girl to say, oh, well, my grandmom and my aunt, my cousin, well, I don't have to worry out until I'm 50 or so, but they should be aware, should know what
Yes,
the
they should be
story is.
aware,
To
but-
check yourself out.
Right. The standard is to start having
Yeah.
mammograms after the age of 35 or 40, and then to have yearly mammograms and self-examination. However, if a younger person finds something, or if they have a family history, particularly if they have a family history of breast cancer occurring in younger women, then they should start to be looking more carefully when they're younger.
Right. Now, one other question, how about men? Men can
Men.
get breast cancer too.
Men can get breast cancer. It's certainly much less common.
Holy
There are only-
mackerel.
only
We gotta
about
get that too.
300
I have prostate, colon, now,
Yeah.
breast, no.
There's only about 300 new cases per year of breast cancer in men, while there are 180,000 cases of breast cancer in women. So it's not very common, but it certainly
But
can
it's
occur.
there,
It can
you know.
occur, so the guys do need to be
Right.
aware of it. And there is a trend that people who have family history of prostate cancer and breast cancer,
See, what I like about you.
have a higher
Here's what I
incidence.
like about you, not only because you're one of the best doctors in the area, but not only you do treatment, but you're always looking some way of prevention or getting people involved. Now, you have something coming up, hey, what, in October, okay, where you're going to get free tests, what do they call that?
well, in October, we do
In all October, here we are,
During-
October.
During the month of October, if someone gets a mammogram, which your insurance will cover,
You go to mammogram, you go to,
you go to the hospital for mammogram, during the month of October, we are giving out some free gifts. So
And
it's a
it's
good
free?
time to get it.
You get a gift?
The gifts are free. The
gifts are free.
mammogram
You have
is
to pay?
with insurance.
With the insurance?
Now, there are programs for people who do not have insurance and would like to have mammograms. They definitely should call us because we can find a way for
help you out. If you don't have the
underinsured
green stuff, they
people.
can come up with
Yes,
it. Right,
absolutely. We do
right.
not want,
Is that a big deal? I mean, you know, is it, I mean, people are afraid of, does it hurt?
it hurts a little bit.
A little bit.
But not, but then you
Pinch-
forget about it, right? It is important when you do a mammogram to compress the breast because you're changing a three-dimensional image, a three-dimensional object
Okay.
into 2 dimensions, and so you're trying to flatten out the breast and see if you can see everything in there.
Okay.
So it's important to do
In other
compression.
words, see what's behind, in other words.
Yes,
Right,
you do have to
okay.
compress the breast for the mammogram study, but it really doesn't hurt that much. It really
Okay.
doesn't. And people are different. It bothers some people more than others. It doesn't bother me at all, but I've heard people complain about it. But it's just for a minute. It's just like when you have a baby, you
Get a
forget
little
about the
glass of wine
pain.
before you go there, you'll be hip, and I don't know.
You forget about it in 2 seconds. I highly recommend
I want to put some
mammography.
humor in this, you know, make it, you know, we want people to stay healthy, okay?
Yes.
All right.
And,
Now-
and the other advances that we have in mammography is the digital mammography. That came on the scene in the last 10 years or so. And the digital mammography is wonderful in that you don't have to do a lot of retaking of pictures because you can manipulate the images with the computer, and so they get much better images. And so there's fewer x-rays that need to be taken, and,
Okay.
there's better visualization of abnormalities in the breast with the mammograms
All right,
that are digital.
Now, with this new hospital coming up, you're going to be moving out of there.
Eventually, yes,
Yeah,
in
yeah,
about 2
and
years.
That's going to be 2 years. When I was at
years.
the groundbreaking, you know, I heard something that I don't know, check this out, you know, I don't want to throw cold water or anything, but somebody said that Montgomery Hospital has 8 operating rooms. And the new hospital only has 4. Now, I don't know, for a new hospital, I was thinking, good old Montgomery Hospital has 8. You take like, if somebody needs an operation, and the doctor said, well, I can't because there's no operating room. I'm just wondering, somebody will check that out. I mean, you know, that's what a doctor told me. You know, I won't say who the doctor was, but he says that was a little concern, that they have 8 operating rooms, like if you had to get a colon thing, the other guy might have to get some other different operation. And the new one only has 4, so
Yeah,
it's something to think about, I don't know.
I'm sure that the reason that there are fewer operating rooms in the hospital is that there is going to be an outpatient surgery center. And so a lot of the cases that get done in Montgomery Hospital's operating room are cases that could be done in an outpatient setting in a surgical center. And the professional building will have a surgery center, so I'm sure that's the reason why there
Like
are
a colon-
fewer.
colon
So like
that-
the big cases, like for the
Right.
colon surgery, or if there's heart surgery, all the big
Too,
cases will
sometimes
be.
guys get toothache, I mean, they got to get teeth, the doctor will use the operating room that gets
Yeah,
a major.
but that would be able to be done in the lesser setting,
Well,
in the less intense
Just
setting.
a thought, you know, just if the guy that's running the new hospital, just think about it, you know, add 4 more on there.
Yeah, well, there
It's just a
certainly is
thought.
going to be room for expansion.
What's that?
There'll be room for expansion.
Oh, yeah. Well, they
Yes.
got enough, they got a whole
Yes.
golf course out there,
Yes.
you know.
They have it planned so that the initial hospital, when it opens, will have a certain number of beds and a certain number of facilities. But as the utilization of the hospital increases, there is the opportunity almost immediately to add on. Like the shell is going to be there, and they just need to outfit the rooms.
Okay.
So they're planning for the
They
future.
still have a helicopter, too. They
Yes.
still fly emergency
Yes.
down to another hospital in Philadelphia, okay? All right, now, well, tell me something about you now. You weren't born a doctor, right?
No.
No, nobody. Like same thing
No.
with me. I was a policeman. I wasn't born a policeman, you know. I was born in Brooklyn, and you know, in a family. I have 4 sisters and 3 brothers. Now, tell me something about you.
Well, I
People
grew,
want to know something about you, you know.
I grew up in Philadelphia, a Philadelphia girl. I went to Girls High, which is right across the street from Albert Einstein Hospital, I might add. And the high school that I went to was an academic school, and 97% of our kids went to college, and I always had intentions of doing
What do you, how
something.
many children you got?
I do. I have 3 sons.
3 sons.
3 sons.
I met 2 of them, I think. 2
I
of them.
have a 28-year-old son, a 24-year-old son, and my youngest is 17. He's still
Yeah.
at home with us. He's in high school.
And
Yes.
your husband, I
And my
met him,
husband,
right,
yes.
right.
Who I met while I was in
What's your
medical
husband
school.
do? What's-
He is a management consultant,
Okay.
and I call him like a business psychiatrist. He gives ideas to businesses on how to improve their bottom line.
Good, nothing wrong with that, nothing wrong with that.
Yes.
Okay, now, when you started back 28 years ago, did you have, you worked as a help with another doctor? Who were some of the
Yes.
doctors you worked with?
Yes, when I came to Montgomery, I was very fortunate that I was joining an elderly doctor. This physician had been the chairman of the radiation department at Philadelphia General Hospital before they closed. And he was asked to join the department at Hahnemann, who was supplying the radiation to Montgomery, because they were building this new department at Montgomery Hospital in 1977. So he came to Hahnemann, and then he started the program at Montgomery. And when I came here in 1982, I was kind of under his tutelage. And being that he was an old-timer, he trained in the 40s, so that was in the very beginning of radiation therapy. So he's seen everything and done everything. And so I was very fortunate to work with him. He was an exceptional teacher. And of course at Montgomery we had wonderful surgeons at the time.
Yeah.
We had Dr. Nealand, Dr. Carlson, Dr. Nelson.
Nelson, yeah, right.
Nelson. We had Dr. Carlin in OBGYN
right.
and
Norristown guy.
Jack Bennett, yes,
Right,
and Dr. Pikus, who was the one doctor,
Pikus.
when
Oh,
he
yeah, he was a
retired,
baby doctor.
he ordered mammograms on all of his
Right,
patients.
his daughter's a judge.
Yes,
Right.
yes. So it was wonderful coming to Montgomery Hospital. They had excellent facilities, excellent physicians, excellent radiology, and I really learned a lot. Also, I should mention the urologists, Dr. Gottlieb, Dr. Frank, they were wonderful.
Who?
Dr. Gottlieb,
Oh, Dr. Guy.
Jerry
yeah,
Gottlieb?
He was, one took care of him on my prostate cancer.
yes, and Dr. Len Frank was here at the time.
Right.
They were very smart and excellent physicians. I learned a lot from them.
Dr. Perch.
Dr. Perch as well, yes, and his son is a
Dr.
radiation
Dr.
oncologist.
Gottlieb.
Yes,
And then now I got this doctor
Now we have-
now is Rosenthal.
yes,
He's here. He's my doctor now. He's the one that's checking me out now.
very capable young
Right.
man.
Dr.
and-
Golden was the first one.
Dr.
The first time I
Golden.
got diagnosed with the prostate cancer, and it was Dr. Golden. So
Yes.
Dr. Golden, Dr. Birch, Dr. Gottlieb, and now I got Dr. Rubens. I have 4 doctors. Oh my God.
Yes, and
Running
I should
through.
mention the other
That's what happens. You
doctors,
get old. You get everything.
Dr. Osias, Dr. Braun. They're wonderful doctors as well, younger, very nice.
How about?
And I should mention also Lee Blattstein, and their newest, the youngest guy, and Stu Kremer, and Joel Lebed is the newest
What was
doctor
the
in the
doctor?
group.
Samuel just died. He's 100 and
Sam
some.
Cohen, family
Sam
doctor.
Cohen. Yeah,
yes.
he delivered my oldest daughter. Yeah,
Yes, Sam
yeah.
Cohen was wonderful.
He was tough.
And Ed Davis and Dr. Watson,
Yeah.
wonderful family, and Frank Miller.
Yeah,
who's-
Frank
who's-
Miller.
yes,
right. I
Dr.
thought
Heath.
this kid had a box.
Yes, yes,
But now let's talk about my cousin, Frank Tornetta.
yes.
Who was a chief anesthesiologist, right?
Yes.
Now, do you have work connections or what? Do you have something there?
Yes.
What's going on?
Well,
Tell me
certainly,
about that.
I worked with Dr. Tornetta at Montgomery in the early
In other words,
days.
you work, when you do this radiation, you had to consult with other doctors, like surgeons and different people?
Oh, yes, yes, radiation oncology as a specialty is very multidisciplinary. We work with the medical oncologists, the chemotherapy doctors, we work with the surgeons, we work with the gynecologists, depending on what the cases are. And of course, because we did some work in the operating room with the radium cases, I knew all the anesthesiologists as well. And of course, Dr. Tornetta was very big into education.
Yeah.
And he started the nurse anesthesia school at Montgomery Hospital.
Right.
That's really grown into a very respectable institution that has supplied many hospitals with their nurse anesthetists. Now the program's been taken over by a younger guy,
You got a picture or
Mike
something, a little
Cost.
reunion or something?
Yes, well, actually, I would like to say that the nurse anesthesia program of Montgomery Hospital from the Frank Tornetta School of Nurse Anesthetists does a volunteer project every year. And it's a community service thing. And this year, what they did was put in a serenity garden at our cancer center, at our new facility. And I brought some pictures to show the people who worked on the project. And they took an area of the hospital that was overgrown with weeds
Oh,
and flipped over all the soil and brought in beautiful landscaping and benches, garden benches, and had made a beautiful serenity garden that is not only for our cancer patients, but anybody in the hospital can come and eat
Right.
their lunch there, read a book during their
Now,
break.
when,
Yes.
when you leave this, you move out, you gonna do something out there at the new hospital?
Oh, yeah, I'm sure we will.
Take care of my,
Yes.
my cousin, he passed away, but he's.
Yes, yes.
You know what I like? I used to drive the emergency wagon, so I got to know a lot of doctors going to the receiving ward with patients, and I used to go in, and all the doctors would be in the room having lunch. They'd have a separate room there, and I would be walking by, and Dr. Tanetta would see me, and he called me, come here, Hank, you know, he said, look, he said to the other doctors, that's my cousin, you know, and I was in uniform with a leather jacket and boots and all that. So he was saying, oh, I'm proud of my cousin, but I was proud of him for what all he did, you know.
Yes.
But, all right, now, let's wrap it up here.
Well,
What are things we want to wrap up here? We
Yeah,
got
I would just
a
like
couple
to
minutes.
say a few more things about the breast cancer
Go
treatment
ahead.
program.
Hit it with, you got 30
Yes.
seconds.
As
35, 36, go ahead.
As time has progressed, we use combination chemotherapy and radiation when needed. We use genetic testing. If people have the breast cancer gene, those people do better with mastectomies and they're at high risk for ovarian cancer. So in many cases, they're recommended to have prophylactic surgery to avoid developing cancer. And the other thing that's new on the horizon is the Oncotype DX testing, where we look at the patient's tumor and do a bunch of genetic tests on it to determine if the patient has an aggressive tumor that requires chemotherapy or has a less aggressive cancer that can be treated with adjuvant hormonal therapy. And in those cases, we're able to spare people from getting chemotherapy. And this is one of the trends towards
advance.
more individualized treatment, because we're able to figure out more things about a person's individualized cancer, and we can tailor the treatment specifically to them. The other thing I'd like to mention is that the program at Montgomery Hospital has just been accredited by the American College of Surgeons. Our breast program has been accredited.
Accredited,
Yes, and we're one of a few.
that's like an honor, right?
It is an extreme honor, yes. And we're proud of the work that we do in breast cancer detection and treatment. We have a wonderful nurse navigator, Joanne Cipollini, who's been with us for many years, and she runs our support groups. She's a very wonderful
All in
asset.
count of you.
Not all on account of me,
Well,
but we
a good
all
bit of
like
it.
we
All
all
right.
like to work together.
Well, hey, we could go on and on and on, Doctor, okay, but, you know, I'm so happy that you're able to come here. October is Breast Cancer Month, okay? And October, and like I say, Christopher Columbus, he's discovered America October the 12th. Maybe we'll discover a cure on Columbus Day. So, ladies and gentlemen, Doctor, thank you very much.
It's
You
my
know,
pleasure
I really
to be here.
appreciate it. I just can't tell you any more than we try to cover everything within this half hour. And I appreciate the fact that you didn't run away, you stayed by the TV station, or your TV set. So until we meet again, keep bobbing and weaving, and may God bless each and every one of you, okay? And happy October month. Thank you. How's the salute? Where's the salute?